Australia's Aboriginal and Torres Strait Islander population was 744,956 in 2016. This is 3.2 of the total population in Australia. It was estimated that before European settlement, the Aboriginal population was 300,000 to over 1 million people. However, it is hard to get the exact number of Aboriginal people living in Australia as a result of many not participating in the census due to a lack of trust in the government. Aboriginal and Torres Strait Islanders were subject to the brutality of the British law, which effectively allowed British citizens to occupy Australia and disregard original inhabitants. The effects of colonisation began with loss of land, which led to decreased access to food, resulting in malnutrition and increased chance of dying from new diseases that were brought in by the British. Aboriginal and Torres Strait Islanders were subject to water and food poisoning, shootings and stabbings. From 1814, children were removed from their families to be educated and civilised. With the history of the stolen generation, intergenerational trauma and invasion of European settlement experienced by Aboriginal people, it is understandable that Aboriginal and Torres Strait Islanders do not trust the government. When Europeans arrived in Australia in 1788, they brought with them new diseases and alcohol, which Aboriginal people had never had before. With new diseases they had no cure to, many Aboriginal people passed away. With the introduction of alcohol, many Aboriginals did not understand the risks of drinking it, and now still to this day affects the health of many Aboriginal people. Indigenous males had a higher alcohol-related burden of disease than general population males, attributable to all contributing factors. Although more non-Indigenous Australians drink alcohol, Indigenous Australians are more likely to abuse alcohol. Meet Mike. He's a 42-year-old Aboriginal man living in Mount Isa. He drinks alcohol each night and has a family including his wife and children. Mike was a child who was taken from his family in the stolen generation and has never met his real parents and does not know if he has any siblings. This has caused intergenerational trauma in Mike's life, where he uses alcohol to numb the feelings he gets in relation to these two factors. Mike's wife is often worried about his drinking and always encourages him to go see a health professional about his alcohol addiction. He refuses to go through the Western healthcare system because of his perceptions in relation to the services, healthcare system, and discrimination stigma associated with non-Aboriginal people.
Here are some factors that may contribute to Mike's health status. Socioeconomic status, which is the social standing or class of an individual or group. It is often measured as the combination of education, income, and occupation. This flows into economic marginalisation. Mike might not be able to participate in society due to possible discrimination based on his economic status. For example, discrimination on the basis of income or exclusion based on not being able to afford the activity. Discrimination. Health difference between Aboriginal and non-Aboriginal people can be explained by the interpersonal discrimination Aboriginal people experience. Interpersonal discrimination is the discriminatory interactions between individuals, such as demeaning comments by a healthcare provider or shop assistant or the behaviour of a neighbour. One study showed that 40% of Aboriginal people have experienced physical or emotional negative racial treatment in the past 4 weeks of the study, compared to non-Aboriginal people. Discrimination is a major factor in health status, as Aboriginal people do not feel comfortable going into health professionals who discriminate or marginalise them. Cultural dispossession and cultural assimilation difficulties. Mike may feel like he is losing his culture and his cultural identity. At the same time, he may be having trouble fitting in or assimilating with non-Indigenous people and communities. Family conflict and or violence and family history of alcohol misuse. These are all factors that may affect Mike. Transgenerational trauma. Alcohol abuse is a problem that is faced by many Aboriginal and Torres Strait Islanders. However, it is not an addiction that has taken place without cause. Trauma is often associated with consumption of alcohol amongst Indigenous communities. Alcohol can be used as a coping mechanism in order to deal with unresolved trauma. Complex trauma is experienced by Indigenous Australians can result in cascading impacts, which include alcohol abuse, mental health issues, and suicide. The impact of colonisation and its outcomes, including forced removal of children from their families, dislocation of our people from their land, and culture and marginalisation of our people, has led to significant trauma that has passed from one generation to the next. The use of alcohol to manage this pain has led to increased levels of distress for individuals and communities. Employment. Lack of employment opportunities, boredom, and lack of recreational activities in rural communities are contributing factors to alcohol abuse and other drugs.
Some of the barriers Mike faces for receiving healthcare include socioeconomic factors, cost of healthcare, language and cultural issues, availability of services, affordability of services, costs of travelling away for care, shame, psychosocial issues, availability of alcohol and substance, trauma.
Here are some enablers which may help Mike and other Indigenous people with their health and lead towards general health equality. Community education and financial support programs. Acceptable and welcoming healthcare spaces. Increased education of the importance of healthcare services. The inclusion of Indigenous Australians in planning and decision-making process in creating policies and program development. Providing non-Aboriginal staff with community-specific cross-cultural training. Acknowledging the importance of language, culture, and spirituality when dealing with preventing alcoholism. Creating a good relationship with Indigenous Australians.
Overall, the Indigenous community are making progress in combating issues related to harmful alcohol use. The Aboriginal Peak Organisation is an example which aims to close the gap amongst Indigenous Australians. This has been done by organising a number of community forums as well as sponsoring a summit that was held in the Northern Territory in 2012. The main focus of these events are to provide the opportunity for Australian community leaders to discuss priority issues relating to alcohol abuse. The Indigenous community recognise the importance for services that are community controlled, which suggests to be more effective. Therefore, many projects such as the Yuriman Ranger Project and Wali Wollongong Stronger Bella were created to provide holistic, culturally appropriate services to aid people in need. There is still much work that needs to be done in order to improve the health and alcohol abuse of Aboriginal people in rural areas in the northern parts of Australia. By creating more enablers and interventions than ones currently out there, like the example given, gaps in healthcare for Aboriginal people like Mike can be overcome.